Hi everybody. Today I'm going to be presenting the impact of Asian dust and PM2.5 on population health in East Asia. By me, Korn, for Public Health 161 class. This presentation is going to be a scientific study that explores how fine particulate matter from nature and industrial sources is affecting public health across East Asia. Asian dust, also known as yellow dust, originated from arid regions such as China and Mongolia that travel across East Asia, hence the name Asian dust. This dust contains PM2.5, a fine particular matter that can deeply penetrate the lungs and affect your cardiovascular health. Due to public change and industrialization, dust storms have become more intense, posing a greater public health risk. The objective of this presentation, we're going to be focusing on investigate respiratory and cardiovascular health effects, analyze the PM2.5 chemical composition, review public health policy, and emphasizing international cooperation to tackle the issue. Health impact overview. PM2.5 is dangerous because it can enter the lung and the bloodstream. It especially is harmful to vulnerable groups such as children and elderly citizens. It worsens chronic illness diseases such as asthma, COPD, and pneumonia, leading to higher hospitalization rates due to the storm events. Respiratory effects. According to a study by Hashisume in 2020, it is found that the dust exposure caused 1.5 to 3% increase in emergency respiratory visits. The effect is stronger in urban areas due to existing pollution and higher density population. The dust isn't just dirt, it carries harmful chemicals like sulfates and heavy metal that inflame the respiratory system. PM2.5 composition. According to Sao in 2015 study, PM2.5 often includes pollutants like nitrate, sulfate, ammonium from vehicle and coal combustion. These combine with natural dust to create a toxic mixture. This makes the dust storm far more hazardous in urban and industrialized areas, especially in northern China, for example. Cardiovascular effects. PM2.5 isn't just a lung problem, it's linked to cardiovascular issue as well. Studies show even small increase in PM2.5 levels could cause more heart attacks and stroke. In China, PM2.5 is estimated to contribute to 15% of cardiovascular cases, highlighting how widespread and dangerous this pollutant is. Regional public health responses. For example, Thailand. Countries like Thailand have taken proactive steps distributing masks and issuing air quality warnings, but responses vary widely. Many Southeast Asian countries lack public awareness or infrastructure to respond effectively to these recurring environmental hazards. These are some of the public recommendations I have made due to my research. To protect public health, we need 4 things: stricter air quality standard, regional cooperation among countries, strong public health interventions, and reduce population from human sources like factories. Reduce pollution from human sources like factories and vehicle. These actions are essential for long-term prevention. Conclusion. In summary, Asian dust and PM2.5 pose serious health risks, especially as industrialization and climate change worsen dust storms. Without action, we'll see continued rise in respiratory and cardiovascular disease, which should cause for premature death across Southeast and East Asia and the whole Asia continent in general. And these are the reference pages and sources. Thank you and hope you learned something from this presentation.